Welcome to the California Community Living Network's legislative briefing, In-Person Services in a Pandemic. My name is Mark Belanson. I'm the Executive Director of the California Community Living Network. Many of you may know us formally as the California Supported Living Network. And about 3 weeks ago, we went through a rebranding. You can all go to the CCLN.org to watch our video message from our incredible volunteer board of directors to tell you all about that rebranding. I do want to review a couple of logistics before we get started. The questions, if attendees have questions, they can be posted in the chat. You can raise your hand. There's a raise your hand feature. Click on raise your hand. Or they can be asked live at the end of the program. We're going to have some time at the end to answer questions and hear comments from the audience. This briefing is being recorded for future viewing and it will be posted on our website. I want to recognize that our state is currently dealing with some unprecedented wildfires and power outages that may be impacting some of our presenters today. So please bear with us as we wish them to be safe and well. We have done our best to troubleshoot any technical difficulties in our multimedia presentation for you today, but I expect a few hiccups and you should too. Please be patient while we quickly work to fix any snags we may run into during our presentation. Today we're using this opportunity to inform legislators that in-person services have been critical in keeping Californians safe throughout this public health crisis. You will hear about how in-person services rose to meet a pandemic moment in a COVID-19 minute. We have some amazing speakers today to talk to you about the essential in-person services that have continued since March 12th. You'll hear some stories of courage and dedication, highlighting the extraordinary direct support professionals during National Direct Support Professional Recognition Week. We will also hear from people receiving services, providers, and leaders of other statewide organizations. Today's theme is how invaluable the direct support professionals are. We will all take this moment to appreciate the most valuable and essential resource in our system, the direct support professionals. The direct support professionals' role by design has always been to remain in the shadows. This invisible workforce, as you will see today, works tirelessly every day to support people served to be citizens and fully participate in their community, even in a pandemic. In the beginning, we were all pretty busy. When we first began reaching out to our contacts at the Capitol, we quickly realized that they hadn't been aware of all the challenges the in-person services were facing and overcoming on their own, which led us to hold this briefing. We are committed and focused on working together to advocate for what in-person services needs right now. Supported living, independent living, respite, personal assistance, and employment are advocating for relief in the following areas. 1, recognize the outdated and historically low wages for direct support professionals and allow for a competitive wage increase. Temporarily eliminate the sunset language on the 8.2% supplemental provider rate increases. Temporarily waive the requirement for the mandate to utilize generic resources during the state of emergency. Redesign tailored day services and increase access. And most importantly, re-engage and redeploy the direct support professional workforce to provide the essential in-person services that people served and families so desperately need to achieve better outcomes. All of these issues are destabilizing and negatively impacts our ability to respond to a public health crisis. When the coronavirus pandemic first hit us at the beginning of March, the mad scramble began to keep people safe. Service providers' priority was personal protective equipment and sanitation supplies for the safety of the people served and staff. We were hearing of stories of providers, like in the Hunger Games, meeting other providers on the corner to exchange face masks for hand sanitizer. The cost for these items has been significant. Then the immediate focus was on training staff on the best practices of infection control and sanitation and how to look for the signs of coronavirus, all while simultaneously arranging the staff to cover the hours of in-person supports lost due to day services closures, resulting in a dramatic increase in overtime costs. I know that some of our other speakers today will be adding to this list of immediate needs. The State Council on Developmental Disabilities has been critical in the supply line of personal protective equipment for the providers of in-person services. So now I'd like to introduce Aaron Carruthers from the Executive Director of the State Council on Developmental Disabilities. And CCLN and our members want to thank you for the extraordinary efforts to secure personal protective equipment for the critical in-person services. So with that, I'll turn it over to Aaron Carruthers.
Well, thank you, Mark, for that great introduction. I'm going to move us over to a screen share so I can give you a bit of a PowerPoint, because as Mark said, what's most critical is for people who are providing direct services to be able to be safe. Be safe while they're doing it, be safe while they're moving from house to house, and make sure they're not giving anything they may knowingly or unknowingly be carrying to anybody they're providing for. Hi, I'm Aaron Carruthers. I'm the Executive Director of the State Council on Developmental Disabilities, and want to talk about the main pathway of how PPE is getting to direct service providers and the council's role in that. So the State Council, as many of you know, exists to make lasting positive changes in the lives of people with intellectual and developmental disabilities and their families. We do that by training people to be their own advocates. Once they're advocates, we join them in that advocacy, and we do that to change systems. Really could be anything impacting their lives. So at our core, SCDD is an advocacy organization. And early on with COVID, we knew the risks are real. COVID is a respiratory illness. It is without COVID, respiratory illnesses are still the leading cause of death among people with Down syndrome, cerebral palsy, and intellectual disability. So we knew this, and every family member knew it. And as soon as COVID hit, the quarantine was quick and it was immediate. There's a fear of going out, which led to pretty extreme isolation. And there's a fear of letting people in. In those early days without PPE, people were turning away services they needed and were entitled to. This culture really still exists today, and many are still in quarantine. So the council did what it does, and it advocated. It says that we sent a letter stating that all in-person direct services provided through IHSS, provided through regional centers, have to have priority access to the public supplies of PPE. This was on May 1st. And we also looked at those other services that are provided through regional centers that are in congregate settings. And we said you have to prioritize safety. This was in a budget letter to the legislature on May 18th, saying congregate settings like day programs just can't function in the traditional ways without posing a great risk to health and safety persons with disabilities until a vaccine comes along. So as we're doing our advocacy, the Governor's Office of Emergency Services reached out to us and said, well, PPE is a priority for you. We have some coming on supply. Can you and your offices help get some of the PPE out? So the State Council is structured in a way that we have 12 regional offices, and through those 12 regional offices, we started doing outreach. We placed our first order for PPE to see what we could get out, and on May 14th, placed an order for 2 million pieces of PPE. That was huge. We were excited, but it really was starting small. You can see here we were. Is there sound interference?
There is a little sound interference.
So I'll keep talking. So we started small. You can see here one of our, I am muted.
You're good, Aaron.
You can hear me now?
Yes, thank you.
Okay, so we started small, and you could see one of our early bags had just hand sanitizer, paper masks, and cloth masks. We were giving them out through drive-by distributions, and lots of providers, in-service providers who are on the phone on the meeting today joined us. They would drive through, we'd give them supplies, and they'd go off and take care of people. As we went on, more people learned about what we had available. The Governor's Office of Emergency Services continued a partnership and made more and more available. And from starting small with 2 million, we started going big. So you can see here just pictures of the supplies that are coming in. So the PPE in our current situation, we're still giving it out. Again, we're an advocacy organization, but we had an opportunity, and like everybody else in this pandemic, we are being nimble, flexible, leveraging our position, and doing our best to meet the need, whatever the need is. And right now, the role that we're doing is actually physically being a distribution conduit of PPE. What we have available has increased. So we have paper surgical masks, cloth masks, N95, face shields. We have masks with plastic cutouts so people can read lips. We have hand sanitizer from 8-ounce pumps to gallon jugs. We just received in disinfectant wipes, gowns, gloves. We have gloves in all sizes. And we're not doing this by drive-throughs anymore. We're partnering with many entities, and we're up to about 100 entities throughout California. These are many of the people who are speaking today, who are on the line today, and we're grateful to them. Family and self-advocate groups, regional centers have been fantastic partners. Providers themselves, reaching out through special education districts, paratransit, any way that we find targeted specific services for people with disabilities. Currently, we just passed the 100 million mark. Thank you, Jackie, thank you others. This is like humbling to be able to provide the service. On Sunday, we placed an order that put us at a total of 101.9 million pieces of PPE. If you know a group, a disability group, that anybody with disabilities who needs PPE and protection, send them our way. No one should be going without. Want to give you just a brief little story. This is our council vice chair, Jolie Austin, and her daughter, Kelsey Austin. And today they're ending 2 weeks of quarantine. Kelsey has pretty severe needs 24-hour care. She has 3 care providers, and 2 of the care providers 2 weeks ago became positive with COVID. So they've been taking care of their health. Kelsey and Julie have been on quarantine, and they've been waiting the 2-week period to see whether or not they will get quarantined. It's no understatement to say that COVID would most likely result in Kelsey's death. Today is the end of the 2-week period. They are symptom-free, COVID-free, and Julie says this is really the benefit of the PPE. She said every in-home service provider wore PPE when they were in the showers with Kelsey, when they're driving with Kelsey, when they're in the kitchen cooking with Kelsey. And because of that, PPE did its job. It kept the virus here instead of out there. And Julie, as of yesterday, says, this PPE was quite literally life-saving. So thank you to you. This is one of our advocates who received it. And I say thank you to you because this PPE is made available by the $1 billion investment that the legislature made in PPE for the state. And thank you to the Governor's Office of Emergency Services for this great partnership. Back to you, Mark.
Mark, you are currently muted.
My apologies. We are honored today to have our next speaker, Assemblymember Eloise Gomez-Reyes, deliver some opening remarks for our very first CCLN legislative briefing. We're so pleased to have had the opportunity to meet with the Assembly member back in January when we held our first public policy conference. Here's a photo of the group of our members meeting with her. We also can't express enough of our appreciation of the Assembly member's extraordinary efforts to divert the trigger cuts that were headed our way back in the January budget. She spoke out so strongly during that time, and we know she worked hard to find efficiencies elsewhere within the California state budget so the cuts were kept as far away from our system as possible. So with that, we give a warm welcome to the Assembly member, Eloise Gomez-Reyes.
Thank you, Mark. Thank you so much. And that photo reminds me of a better time when we could all be together in person. Thank you. I appreciate that you had come up to see me. That was special. Thank you. I also want to thank the California Community Living Network for inviting me to speak today. As chair of the Assembly Human Services Committee, I'm honored to participate in this briefing today, but I'm also honored as well to participate in numerous discussions we've had throughout the year to address these very issues you're talking about. As we all are very well aware, and as you mentioned at the beginning, Mark, COVID-19 pandemic has disrupted our ways of life in so many ways. As a community, we made rapid changes and we quickly adapted to new ways of living, of working, and providing services. Many of the changes that we made were seamless and uncomplicated. However, there's a however. Many changes took a greater amount of coordinated effort to reach a new normal. The rapid changes that were necessary to adapt to the pandemic did not affect all populations of our community equally. and in fact tended to affect those that rely on public services and their providers. It affected them the most. The individuals with intellectual and developmental disabilities are among those whose way of life was most affected by the rapid shift in delivery of services due to the pandemic. For those individuals living in community-based settings, residential services are essential for maintaining their livelihood. These services include supported living and independent living for services for individuals who choose to live in homes they own or lease in the community. Respite services for individuals who live at home with their families, and employment services for individuals working in our community. Shelter-in-place mandates and social distancing policies have created a challenge for providing some of these services in person, and as a result, changed the delivery of some of these services. Additionally, some individuals who were receiving employment services now found themselves with a new title of essential worker at their jobs and had to adapt to changes within their work settings as well. Despite the challenges, service providers have worked tirelessly to maintain as much of a sense of normalcy for their clients in the midst of this public health crisis. It's worth noting that this briefing is being held, as you mentioned, during the National Direct Support Professionals Recognition Week. That's a mouthful. I would be remiss if I didn't acknowledge and commend the direct support of professionals that work with our IDD community. Their dedication to providing services was apparent before the pandemic and has only become stronger as we continue through this crisis. They have fought for overtime to continue working for their clients. They've struggled to find PPE, although we already know the great success as a result of that. And that was necessary in order to provide the in-person services in a safe environment. And through it all, they continue to provide services to those who need the services the most. These direct support professionals are frontline workers. They are essential workers, and they provide necessary services. I want to take a moment to emphasize that we recognize the work that you do and to thank you for your dedication. Our IDD community and their families rely on your service. Thank you again, California Community Living Network, for allowing me the opportunity to speak today. I look forward to learning more about how in-person services have continued and will persist throughout this pandemic. Thank you.
Assembly member, thank you so much for your time. We appreciate you, and we know you have to run off, but amazing comments. Thank you, thank you, thank you.
Thank you so much. I look
we'll
forward
be in
to
touch.
our conversations.
Great, great. Looking forward to continuing. Bye-bye. Thank you.
Bye-bye.
Next up, do we have Brian Winfield from the Department of Developmental Services here? Brian, are you here?
Mark, this is Amy Westling from ARCA. I heard from Brian that he's on a phone line.
Gotcha.
And it appears he's muted.
Oh, we would need his number to unmute him.
The last four digits are 9491.
So while we're unmuting Brian, I just want to say, the Department of Developmental Services has been extraordinary in communicating with CCLN throughout this pandemic. We have had regular meetings. We are able to bring our concerns. At any point, they're willing to meet with us as we hear what's happening on the ground from our members. So thank you so much, Brian, for being here with us today.
Hi, Mark. Can you hear me?
We can. Thank you.
Great. Thank you so much for inviting me this afternoon. Brian Winfield, Chief Deputy Director of the Department of Developmental Services. Our Director, Nancy Bargeman, sincerely regrets that she was unable to participate today. And it's truly an honor to be a part of this legislative briefing and to honor and to recognize the direct support professionals that do the hard work every day. In California, we are such a huge system of partners, and during this pandemic, we have seen that over and over again, that with the individuals that we are here to serve, their family members, the service providers, regional centers, all of our stakeholders, and most importantly, the direct support professionals, all of us working together. We have really risen to this challenge. I don't need to go into detail about the challenges that this has caused because every one of you is living it every day. And we cannot express enough our gratitude and our appreciation to those who have worked in all of the various settings in our service system, supported living, independent living, day services, respite, personal assistance, and I could just go on. But again, want to, on behalf of the Department of Developmental Services, thank you for your tireless work, for your dedication, the passion that you bring to the work every day, and just send our appreciation for the partnerships that we have felt and experienced over these many long months. Looking forward to more work to come, but as partners, we can certainly rise to the challenge. So again, thank you on behalf of the department.
Thanks so much, Brian. We echo your appreciation for the collaboration that we've had throughout this pandemic and the wonderful communication. And we hope Nancy's having a great vacation.
Me too.
Well deserved. Next up, we have Amy Wessling from Association of Regional Center Agencies. Again, another entity that CCLN has kept in constant contact with. Amy always gives us her much valued time to talk about what we're hearing from our membership, what successes, what concerns, and immediately makes herself available whenever we ask. So we're so pleased to have her here today to talk a little bit, to talk to us a little bit. So sorry about that. Amy Wessling from ARCA.
Yes, thank you so much, Mark, and thank you to the over 200 people who are making time for this presentation today. That's really remarkable, and it really speaks to the interest in this system, how it's supporting people with intellectual and developmental disabilities, and the interest in understanding how people's needs are getting met. And the number one way people's needs are getting met right now is that DSPs continue to show up. They show up to work, they do the hard work, they are out there even when it's scary and even when there are real concerns in their own lives, when we've all had all kinds of radical changes in our lives. Children who are no longer attending school, concerns about the rest of our community. They've had all those concerns too, and they've shown up and done what was needed to make sure that people with intellectual and developmental disabilities were well cared for, and that their needs were met, and that they continued to have those things at their disposal to be able to stay healthy and safe. And one of the things I wanted to share with you today is a video that Alta California Regional Center put together of people who are served by the system and their families and the staff from the regional center really just taking a moment to say thank you to all of the DSPs. And they can say it so much better than I can. So without further ado, I will try to get it going.
Phil Benet here, Executive Director at Alta California Regional Center. Hey, I just wanted to take a moment to introduce this video of thanks from our community for the incredible efforts of our direct support professionals. I know that many of you all as direct support professionals have put yourselves in harm's way to support our clients and our families, and I just got to tell you, you guys and gals are my hero, and I just want to say thank you from the bottom of my heart.
Hi everyone, I'm Allie. I'm Matt's little sister who receives services from Alta. I just wanted to thank all of the direct service providers for all that they're doing during this trying time.
Hello, my name is Zachary Miller. I'm a client of Alta. This goes out to the service providers. Thank you for supporting us in this times of this pandemic.
Thank you very much for your work that you do.
I wanted to thank all the DSPs out there in the Alta California Regional Center that are helping all of us clients during this very unusual time. Thank you so much. You may not know it, but you do make a difference. Thank you.
Hey, this is Daniel saying thank you for the providers that are providing services at this when it's pandemic. So again, just want to say thank you.
Hello, my name is Robert Levin. I want to thank both PEC and CDS for all their hard work on supporting other clients while this COVID-19 pandemic has still been going on.
Hi, this is Bernadine, and we just want to say thank you for all the support system that we've had.
Thank you, Alta staff, for giving us masks and gloves for our safety.
I want to thank all the DSP direct support personnel that help people with disabilities, especially those that help me.
Hi, my name is Stephen Sanchez. I just wanted to say thank you to all the ILS agencies out there for working during the COVID-19 situation. I really appreciate what you guys do. Even my former facilitator, Michelle, it's great that you're still able to go out and do assessments for new people. I just want to say thank you to you guys, and I really appreciate it.
Say hi.
Hello, everyone. My name is Lisa Cooley. I'm the chair of our regional center's local self-determination advisory committee. I'm doing this video today to say thank you to this direct support workers that make our interdependent lives possible.
Hi, my name is Rick Hodgkins. The following people I want to thank for helping me through the pandemic. First, I'd like to thank the service coordinator I have for the past 14 years. I'd like to thank my 2 IHSS workers.
Teresa Wilson. I'm now Teresa client. I thank everybody taking good care of me.
Thank you, residential providers, for doing such an awesome job.
Oh, Amy, that's awesome. Thank you so much for sharing that with us.
Of course, and thank you to Alta for giving me 4 minutes of content to take my 5-minute slot.
Amy, thanks so much. And again, we look forward to continuing to talk about the important things that are happening and appreciate your open door to CCLN. So thank you.
Absolutely. We're only as good as, we're only as strong as our partnerships. And so really appreciate it. Thank you.
Thank you, Amy. Next up, we have Lisa Kleinbub. Lisa is the Executive Director of the Regional Center of the East Bay. The Regional Center of the East Bay is really doing some amazing things over there. So we look forward to having her speak with us today. Lisa, are you there?
I'm here, Mark. Thanks
wonderful.
Thanks for the intro. I'm Lisa Kleinbub. I am a Regional Center of the East Bay, and we are the regional center that serves Alameda and Contra Costa County in the San Francisco Bay Area. And our area was one of the first areas to really lock down very tightly and have a strict shelter in place. And I want to say that direct service professionals have always been critical in our service system to supporting people to live the lives that they want to live in their communities. And really, respect for direct service professionals is a core value of anyone who knows what people's needs are and anyone in any part of the regional center system. And so I want to let you know that it is a core value. But in the pandemic, I think it's really brought the importance of direct service professionals' role into focus, and into focus not just for our community, but for many other areas in our society as well. I think we saw, in the face of shelter in place, we saw direct service professionals really put aside their personal concerns about their own health, in the face of people talking about how contagious the virus was, putting concerns about their families aside in many ways to continue to show up and to continue to ensure that the people they worked with got services and supports that they needed. And their role in keeping people safe and healthy was essential. And the rate of COVID-19 among people living in their own homes, living with their families in small settings, was really low. If you compare the rate of COVID-19 among people who lived in their homes and in small settings to people who lived in larger congregate settings like nursing homes, dramatically lower rate of COVID. And that's really attributable to the work of direct service professionals following protocols, practicing what they were taught, and really taking care of everyone around them. We saw the essential nature of the work. And I think as the pandemic went on, we saw the work to get PPE to direct service professionals spread from the state council advocating for that, from DDS providing the PPE to these providers, to our counties recognizing how important these workers were and how they had to be seen in getting PPE the same as hospitals, the same as IHSS workers, and so forth. So I think their value was seen across other systems as well. I think the other thing is that we have seen that direct service professionals have often not been given a competitive, livable wage. And especially in high-cost counties like we are, it is really a problem. And direct service professionals often have to work multiple jobs in order to support themselves and their families. And I think during this pandemic, we are lucky that we have been given some ability to work with service providers so that we can minimize the number of people that a direct service professional works with at one time, so that they might have to work overtime with one person, but we're not having multiple households interacting with each other through one worker. And this has been really important. And I think it's something we need to, as we think about respect, we think about the importance of these workers, we have to think about how do we let people work one job, have a livable wage, so that they are able to provide the quality type of support that we all want and we need to have. And so I think I'll end by expressing my gratitude to everyone who's been providing direct face-to-face services and those who've been providing other supports as well during the pandemic. It is so critical. But I hope that what we've learned carries forward in the practices in the future. And so I will hope that as we look at rates and wages, that direct service professionals are appreciated and respected. And I will also hope that as we look towards the future, when the vaccine is available, that they are prioritized as well as a population that serves people who are at higher risk of COVID-19, but also as a population that really is frontline and that should be appreciated and prioritized as well. So thank you, and I appreciate listening to every one of you who has spoken so far today, but mostly thank you to the direct service professionals.
Oh, Lisa, Thank you so much. And know that we all have our eye on our CEB because you guys are doing some really creative and innovative stuff right now, and really highlighting that. So we want to appreciate you giving us your time to speak today, as well as the work that you're doing over there. So thank you very much. All right, our next speaker up is Judy Mark. Judy is the president of Disability Voices United and also a parent. And I gotta say that Judy has been quite busy since this pandemic started, hosting webinars, informational webinars on the pandemic, on a variety of different topics. I've tried to glean some of her facilitation skills as I do larger programs like this. She's kind of my mentor in that aspect because she's really done some amazing work to keep everybody up to date. Judy's also spearheading a Disability Voter California initiative to really get the vote out this year. So with that, I will introduce Judy Mark, and Judy needs to be unmuted so that she can speak. Welcome, Judy.
Thank you, everybody. I just want to start by saying how honored I am to be on this webinar to honor the people who have been the true heroes in our system since the pandemic started. My relationship has gotten so much closer through the pandemic with the California Community Living Network, and getting to know all of you has been such a pleasure for me. As Mark said, I'm a parent. I'm a parent of a 23-year-old young adult with autism who needs 24/7 supports. And through this pandemic, we couldn't say to the support staff, you can't come in. So they continue to come in. Unfortunately, very early on in the pandemic, in late March, one of my son's 2 staff tested positive for COVID-19. So we are the face of this in our family, where we were desperate for PPE, and it took a lot of effort to get that PPE. Our regional center turned us down to get PPE, but DDS are also heroic at this time and were able to send us PPE immediately. We practiced really good hygiene, and amazingly, no one in our family got COVID, even though the DSP for my son was sitting at our dinner table 10 hours before she got her first symptom. So we feel very lucky. I just want to share with folks just a few things that Disability Voices United has been working on in relationship to these issues. And for you to see how important it is that families can rely on in-home support. So first, I'll just very, very quickly go over a survey that we conducted from almost 550 family members and self-advocates, people with disabilities, mostly reflecting the ethnic makeup of our state. One of the things we found is that Latinos have a much greater need for services during the time of the pandemic. Probably, we're guessing, because many of them are essential workers. People need more services, but they weren't getting them. We continue, now this is a survey that was ended in early June. However, we continue to see this play out, that people need more services, are not able to either get them approved from the regional center, or even if they were approved, they can't find staff to be able to support them directly in their homes. They're also really needing the support. This is back in June, that they needed the support, but they're just afraid to have people in their home. I think people now are understanding how the virus is spread more, and I think more and more people are willing and wanting to have direct support work in their home, whether it's for children, it's behaviorists or respite workers, or whether it's for adults, to have independent living services or others in their home. The programs, for adults, there are day programs like my son participated in, and he was able to get his day program staff to be in our home every single day. That was not the case with many day programs. As many of you probably know, DDS just issued a directive in the last week or two allowing day programs to bill for a full month, even if they have minimal interaction or no interaction with clients. As an organization, I can say we have a lot of concerns about that. It may not be shared by everybody here, but it's certainly, as an organization directed by and for people with developmental disabilities and family members, we have grave concerns about that. People really, really need this in-person support and on a daily basis. We believe the focus should be on hourly services so that there is an incentive for these service providers to actually providing these needed services. I also have to say in this setting that I found this directive to be incredibly unfair to the heroic supported living services and ILS workers who cannot bill if they don't show up, who cannot bill for providing a phone call. And so I really hope that we're going to think about this in a different way as the days and weeks go forward. Finally, I just want to say that what we're hearing from families right now in a desperate way is they need in-person services. Parents who are caring for their children during remote learning is taking a toll on them. They can't work. Schools, I have not heard of a single school district in the state that is providing a one-to-one aid in the home for a child. It doesn't mean that it is not happening. I have just heard of countless cases of parents desperate to have, that their child is not being able to access remote learning unless somebody is sitting next to them the entire time. We're also hearing older parents caring for their adult children at home, and they are exhausted. They are really exhausted and really need help. So what do we want to see as an organization? And I know that we work with other organizations and supported living organizations on this, is that we want to see the same flexibility and opportunity for creativity given to providers afforded to us, to families, to be able to get more of those in-person services. We want expanded training on the use of and increased use of participant-directed services, which, by the way, since Brian is on, I will ask once again for about the 10th time. I would like to see data on participant-directed services and the use of it, because I believe the use is quite small. And then I always have to say that we need to expand the self-determination program right now to everyone statewide who needs it, because that is where we need to be going in the system. The system cannot go back to the way it was before. And so with that, I'm going to stop sharing and just say, thank you to Mark for inviting me on this webinar, and you guys are the family's heroes. Thank you so much.
Judy, thank you so much for presenting today. You'll always speak your mind, so we appreciate that.
Truth to power, baby.
Thanks so much for the great connection that we have. It's been a relationship that's been building throughout this pandemic, and we definitely look forward to continuing to collaborate with you. So thanks so much again. All right, so next up, we have Ruth Myers, Dr. Ruth Myers, who's going to talk a little bit in more detail about in-person COVID-19 medical supports. Welcome. Wait, no.
Marty's next.
Sorry, my apologies. I was jumping ahead in my spreadsheet. Before I turn it over to my lovely co-host, Jackie Dillard-Foss, to introduce our next speaker, I just want to say thank you to Marty. Marty has been such an incredible resource for us as a network. He has such amazing connections. He has such a long history and experience in this field. So before Jackie introduces him, I just want to say a big shout out thank you to my penguin pal, Marty Emoto, and I'm going to get him a CCLN bow tie probably at some point. So I'm going to turn it over to Jackie so that she can introduce Marty. And Ruth, you're up next.
Hello. My name is Jackie Dillard-Foss. I'm the Executive Director of Strategies to Empower People, and also the co-chair of Governmental Affairs for the California Community Living Network. And surprisingly, I used to not speak my mind, and then I was introduced to Marty Emoto, and he told me if you wanted to be heard, you needed to speak up. So over the 20-something years we've known each other, not that Marty or I have aged one bit, I think that watching him really passionately, as an advocate, go and give us information we need at all times. And really, at times, it's like 3 a.m. you get an email from Marty that his sister is his driving passion. And he really taught me how to speak up, to really go out there and do it. And so I am, my growth from being an advocate is all Marty Emoto's fault. So anyone that doesn't like when I speak up, you should send him an email. Anyway, I'd like to introduce Marty Emoto from the California Person-Centered, you keep on changing your name, I keep on saying CDCAN, Marty, so it's the California Disability Consumer Action Network and Person-Centered Supports. If I got it wrong, Marty, you will correct me because you always do. So my friend and my mentor, Marty Emoto.
Hey, thank you very much. And I really appreciate being invited to this briefing. And I appreciate your words, Mark and Jackie. And yeah, you did kind of mangle the organization, this California Disabilities Senior Community Action Network, but it's close. As Jackie said, what drives me to be an advocate, as it drives Judy and all the previous speakers and the ones that will follow me after today, after me, is a person in my life who I loved so much, that really inspired me, partly because she needed help, but also because it was the right thing to do. It was my older sister, Elena, who had developmental, physical, and mental health needs. She passed away in 2003, but I was the closest person to her in my family to help get supports for her all the way to the end of her life. And she was my inspiration, as many of the people who are alive now are my inspiration. I'm currently extended family, the only extended family to a young man who's 28 years old who has Down syndrome, who lives in Fresno. His mother was my close friend. She passed away, 2 years ago. She begged me to actually, be there for her son because he had no family. And so I promised I would. And so since then, I've been the only extended family to him. He stayed with me for a month this past summer because there was some COVID issues with his support staff. And so I'm really involved on that level. I'm also involved as a statewide advocate. I'm a member of the Master Plan for Aging subcommittees, been a member of the Olmsted Advisory Committee of the Developmental Services Task Force. But what matters most is I'm a family member and the people that I care about. And also, by the way, I had COVID for about 4 or 5 weeks earlier in March. I think I got it at a hearing at the state capitol. And then that was a really difficult time, but I made it through that. I just want to underscore what other people have said today and what others will say after me about the people who provide the in-person services, and to underscore that they are invaluable. But beyond that, we must take action steps to make sure those words have real meaning. We are all vulnerable and at risk to COVID. And in certain parts of the state, we're vulnerable to other disasters like the fires. There's a line from the West Wing show that goes that decisions are made by those who show up. From the beginning, people who provided in-person services were there. They showed up. Supported living, in-home respite, IHSS, independent living services, and others. They showed up. When everything else shut down, when people sheltered in place, those people never stopped because the needs of the people they serve never stopped. They risked their lives and the lives of their own families to continue going to stores for food, for supplies that were needed for the people they serve. They did this when resources for PPE were non-existent or scarce, when mask mandates were not in place, and there were no mandates specific on social distancing. So what is needed now is not just an acknowledgement of the people who provide these essential services since day one, but a commitment, words, and action from the state and all of us to make sure they will have the resources and help they need when they need it to respond to COVID and the other disasters so they can continue serving our families. We are in the middle, I keep reminding everyone, and it does take some reminders, of a worldwide pandemic, and we must not react in ways the state did during the economic crises of the past, the recessions of 2009, 2003, the budget shortfalls in 2003. This is different. So as we look to the January 2021 budget and the May revise that will follow, we need all of us as advocates, legislators, and the administration must do everything necessary to support those on the front lines responding to COVID. We must not allow policymaking to emerge like it did in the May revise when it had $14 billion of trigger cuts. So number one, and this is not necessarily in order of priority, number one, reductions. We must not cut the supplemental rate increases or cut IHSS. Both are scheduled to happen at the end of 2021. Also, there are cuts to Medi-Cal that are scheduled at the end of 2021. Number two, unmet need. We must monitor and respond for people not being served who need in-person services. Number three, crisis response. We must establish a real ongoing crisis response monitoring team at state and local levels that includes people providing or receiving in-person services. This includes crisis impacting service gaps, housing such as evictions, transportation, medical health care. People respond differently when we are treated as partners and not victims. Number four, COVID monitoring. This is something that does not exist. We need to get the state to implement monitoring of people who provide in-person services statewide who test positive, people who require hospitalizations, and people who have died as they monitor the workers in the skilled nursing facilities. Number five, guidance. We need better guidance from the departments on in-person services, including protocols if someone tests positive, what resources can be applied to fill the gaps. And families, most of all, need to know what to do, and also about training. And finally, number six, disparities. We need to monitor and respond to the impact of increasing disparities due to COVID for in-person services, including impact on people who are not documented. In closing, Hemingway once wrote that many are broken by life, but some are made stronger in their broken places. My family was broken by life, as so many others, including the people who provide in-person services and their families. Those workers deserve not just our words of thanks, and they will get that, but most importantly of all, they need words that result in real action that acknowledges that each worker, each person, and their families are invaluable. Thank you.
Marty, thank you so much. We were so honored to have you speak today, and I just wish I could tap your brain for your knowledge and have a direct link. But I know that we continue our collaboration with CCLN and you, and we look forward to doing that moving forward. So thank you, thank you, thank you. And now back to my lovely co-host Jackie to introduce our next speaker, Dr. Ruth.
Marty, I will figure out how to say that CD can, but you know, I am 55 now, the brain is slower. Anyway, I'd like to introduce you to Dr. Ruth Myers. I met Ruth 20-something years ago, and she always helped guide us on how we treat a person with a developmental disability and labels of behavior where we approach it medically. And that relationship kind of formed when she started to work with me directly over providing support for complex needs folks. Who knew then, Ruth, that when COVID hit, that what she provided to STEP and to CCLN would be information and knowledge to make sure that we did everything in our power to have training and information to our direct support professionals so that individuals with developmental disabilities would not contract COVID, because we knew it would be for many a death sentence. So Dr. Ruth Myers is a national and international leader on services and information on medical support for folks with developmental disabilities. She is my friend. She used to be a mentor, so I was always afraid to talk to her, but now we're a friend and we can chit chat. Anyway, I'd like to introduce you to Dr. Ruth Myers when she talks about what's going on nationally and helps us understand that, and to introduce two gentlemen that mean so much to both of us. Dr. Ruth Myers.
So much. I am unbelievably grateful and honored to be part of this gathering today, and I feel like I get to watch a whole bunch of my heroes talk about stuff, which is very cool. I'm going to subject you to a PowerPoint that summarizes some of what we think we're learning in the medical world about people with IDD and the COVID, the coronavirus. And this is a very brief medical update, and obviously I'm hoping to hang around to answer any questions if I'm able to do so. A lot we still don't know, a little bit we do know. First, I want to start with some of the numbers from the state of California. It's 151 people who live in California who have IDD have died from COVID-19. People in SLS, ILS, and family homes account for 89% of the population of people with IDD in California. And people who have died, they account for 30% of the deaths of persons with IDD from COVID-19. Well, where's the rest? Californians with IDD who live in large group facilities account for 8.8% of Californians with IDD, and these settings account for 70% of the deaths of persons with IDD from COVID-19. This is already starting to educate us, isn't it? Recent estimates, and then this is from an article that came out just about 2 weeks ago, analyzing evidence from all over the United States that shows that closing schools early saved about 40,000 lives in the United States. Now, why do we care about closing schools saving lives? People thought at first that was a little bit alarmist because after all, children can get this disease and not even have symptoms. Oh, wait a minute. What happens when somebody doesn't have symptoms and they have this disease? They're contagious for 8 weeks. AstraZeneca had to stop and reevaluate the most recent vaccine because a test subject got sick. So we don't have a vaccine, the timeline's longer. What's the other thing we kind of got from that evidence base about closing schools early and saving lives? Well, it does kind of show in an evidence kind of a way that staying home can save your life, which a lot of people doubted that wisdom, but it seems to have been borne out. More importantly, people with IDD who are exposed to the virus are up to 4 times more likely to get the illness if they're exposed to the virus. The death rate for people from California with IDD who contract coronavirus is 2 or 3 times that of the general age-matched population who get coronavirus. This is true whether or not there are any factors besides the intellectual or developmental disability, and is consistent with the findings of the American Association of Health and Disability, who reviewed these data from throughout several sites in this country and in other countries. So we have no treatment. Remdesivir was the most promising antiviral medicine, but the trials are showing little or no benefit. So we also know that persons with IDD, several of you have mentioned disparities already, generally do not receive the best level of health care in situations when resources are stressed. In fact, in other states, disability rights advocates have had to go to court to fight statewide medical triage policies that specifically denied intensive care unit care to persons with IDD who were very, very ill with the coronavirus. It was statewide policy in a number of states. California didn't go that way. Thankfully, they went the opposite way, thanks to the effective work of the advocates in this state. But that is just how severe medical discrimination is and has become in several parts of the country. In California, and I have the great honor and pleasure of working in every part of California over the last, how many decades, Jackie? it's been a few. We're seeing recently, unfortunately, an increase in inappropriate do not resuscitate orders assigned by a doctor against the patient's wishes, or abrupt interruptions in ongoing care. Well, your doctor's not available and we're not going to provide you with another one for 8 weeks, and we're not going to renew your medicine. These are disruptions in care that are difficult for everybody, and they're life-threatening for many of our friends and neighbors with IDD. So at this time, the evidence we have so far suggests the only way to prevent death from coronavirus in people with IDD is to prevent exposure to the virus. This means avoiding groups, doesn't it? It means staying as far away as we can from hospitals and nursing homes. And we need extra advocacy for the best level of healthcare when a person gets sick with anything that requires them to be in a hospital. And I've seen so many of you step up and do that, and it's absolutely brilliant. In addition, for the most part, first responders and healthcare professionals have been utterly heroic in their response to this pandemic. But we also see, and this is popping up in California as well as several other parts of the country, nurses, teachers, other frontline healthcare workers basically retiring or going on strike because they're so frightened of this virus. Doctors just about everywhere have eliminated just about all of their in-person services. The infections with the COVID, it was originally thought to be what? A not very serious, not very long-lived respiratory illness. But we're finding that's not the case. First, we've learned that people are actually the most contagious the day before they show symptoms. And many of the studies, and I poached this from a bunch of really smart people at Harvard in June, they're finding that people who've been infected shed active virus for 8 weeks. Meaning that PPE is necessary all the time, even when we're working with each other and nobody seems to be sick. And thankfully, so many places around California have really stepped up to make this a reality. A tiny little side note, my brother is the chief of service at one of the most prominent children's hospitals in the United States, and they can't get PPE for their doctors, nurses, and other healthcare workers. So they're washing and recycling paper masks. So what you've accomplished here in California is absolutely dazzling. People are staying sick with this thing much longer. There's a catastrophic neurological variant that is causing tremendous neurological injury to some people. And people are getting reinfected. So what we hoped for in terms of an easy time of it just isn't going to happen. And I think everybody who's paying attention is pretty worried about what's going to happen as we move from the current pandemic into current pandemic plus flu season. Despite all this risk, and as everybody has pointed out, direct support professionals who provide in-person, in-home care to persons with IDD are showing up to work. Everybody else has said that too. They're providing sophisticated in-home care that prevents people that are sick from having to go to the hospital at all. They're preventing transfers when people are coming out of the hospital or when people are ill with something else. They're providing enough care, good enough care in their homes so those people don't end up getting transferred to those high-risk settings like skilled nursing facilities. They're assisting people with IDD with complicated and necessary precautions so they can do the most important part of not dying from this virus, which is preventing getting exposed to it. They're keeping people active and engaged and safely out of those group settings that are just completely unsafe at this time. And as everybody else has mentioned, at risk to themselves and to their loved ones. What I've observed seems to be working, and what others are saying is working in the places where things are working, is it starts with leadership. In person, all hands on deck, enduring commitment. What do you need? You need pulse oximeters, you need PPE, you need blood pressure cuffs, you need Lorna Doones, you need fudgesicles, whatever you need, you're gonna get. And the orientation is not just towards a marathon, this is a decathlon. It's going on and on. Some organizations have contracted with private COVID testing labs because right now the currently available publicly funded testing can take up to 2 weeks before people receive results. And that's just too much time to wait for all kinds of important staffing reasons. Obviously, the PPE is essential. Comfort supports also essential. They may not sound like they're all that important, but in fact, every good study that's been done by every major mental health and rehabilitation health organization shows that the more comfort that can be introduced, the better people do. Their immune systems function better. If they get COVID, they will be much more likely to recover from it. And even to the point where, I don't remember how many it was, Jackie, but you bought how many backyard swimming pools for, yes, for people that being able to get in the water was the best thing they could ever possibly do. Runners to deliver things, drive-by encouragement, and many places have implemented a whole web of instant access to support and medical expertise. People have a medical question, they can get it answered right now. I think this is redundant to say, but the people who provide this in-person, in-home care have made it safer for everyone. How can we better protect and honor and continue and sustain their work? I think that's what everybody's got a lot of good ideas about. What I want to finish my little part with is, this is a fella named Jamal. And in this picture, you can't tell because he has this amazing smile. But in this picture, Jamal was very near to experiencing the last day of his life. His fever was well over 103. He was so weak and in so much pain and so sick and coughing so much that he couldn't really take fluids. He couldn't do anything for himself. And this very nearly would have been the last day of his life because he was infected with a very severe form of COVID-19. And I'd like to move from this into a videotape that shows the rest of the story.
Thank you so much, Dr. Myers. I believe we have Lynn chiming up the next video. Jessica, can we share Lynn's? Here we go.
Lynn, I believe you are muted, so none of your sound is coming through.
Can we unmute Lynn?
Well, the reason we want to talk to you is because you're a hero. Yeah. Right on.
Okay.
So, Jamal, we need your advice. How'd you get through it?
Me and Joseph.
Yes. Yes.
Yeah.
So how did you
With help, with help.
get sickness together?
Yeah, it was pretty tough at first, but once we just stayed consistent with everything, with the medicine and getting him with the fluids and the inhaler, I say after the week, everything was cool.
God bless you for that, Joe.
Joe, you are in the ultimate superstar hero category, just saying.
Thank you, I appreciate it. I'm just being me. This is just who I am.
That's right. You were just being you, Joe.
That's right. It's no big thing to you.
Like, I ain't doing nothing different. This is me. I always did this for everybody.
You want to talk with me? You finished. You talk? You finished? Okay, he's finished.
Thank you, thank you, thank you.
Thank you, thank you.
You're amazing. I don't know if I know you say it's just you, but just you is amazing.
I really don't know how to take that because a lot of people tell me that I just don't know how to take it. I'm like, I'm just, just ordinary me.
Right.
It's just my heart. I just felt like it was right. I just feel like I couldn't leave them.
How's the family through that process? Because I know you have wife and children.
It was really hard for my youngest one because she didn't really understand as much. So she ran a lot and wanted me and stuff like that. But my oldest was there to tell her a little bit more about it and be there for her. So, but it was good.
They didn't get sick though, right? No, because you were in quarantine. You were in isolation.
I worked that whole week before this even happened, so I didn't even get a chance to go home at all. So it's kind of like a blessing in disguise, because that's why I told my mom, I was like, I really feel good because we contained it just at Jamal's house. We didn't let it go to other people.
Yeah.
And I feel like that's a victory for us. We didn't.
Absolutely. Absolutely.
You mentioned that part of coping was to kind of get into a routine with you and Jamal.
Yeah.
What worked and what didn't work?
Well, he was so out of it. He was willing to let me do whatever because he knew he was in pain and he was sick. So every morning, 8 o'clock, I try to sit him up, give him his Tylenols, give him his other meds, try to get him to eat something. He wouldn't really eat a lot, but I know he needed to eat something. So I still give him the soup. He was stuck on chicken noodle soup. All he wanted, chicken noodle soup. But I try to give him other things too to fill him up. And then we started doing that for about, I say like the third day, we started to go outside because I heard vitamin D is good for you and stuff like that. And then we was talking about his breathing and oxygen, and we had a little confusion with the little oxygen reader, and we was like, well, we need to get his lungs working. Let's get him walking outside. Let's get him sitting in the sun, drinking tons of water. And as the days went by, he just got happier and happier. I could see him smiling. I could see him talking about the movies. And then one morning, I just went in there. He's already just sitting up. He's just sitting up in the bed. He put his own movie on. Usually I have to do it because he's been so weak. I had to change the movie. I had to keep coming in checking when the movie's over with so I could change it. And then he just started doing it his own. I ain't waiting for him to change my own movie. I come back, the movie changed already. So that's why I know he was getting better. But we just had to stick on it. Really the Tylenol. Like if you don't stay on the Tylenol to beat the fever, that was it. So we just couldn't miss a beat with the Tylenol. We had to stay on it.
We're sick at the same time.
Yeah, it was crazy. Like the next day, I felt fine, but I seen all this happen because I seen it in his face that whole day. Like something's wrong with him. And then he started the little cough. And that morning before when I checked his temperature, it was like 97 or 98, because that's still fine for us. But he still didn't look good to me. So later on that day, I'm like, man, he was not looking good. I took his temperature again. And that's when it went to 102. And I was like, yeah, something is wrong with him. So And then the next day, I started feeling sick, bone aches and high fever. And I was like, this is the big one. You know, it was scary, but, you know, we had nothing else to do but fight.
If there was any advice that you could give to the other staff that are, you know, it's still looming out there that their employer might get sick or they might get sick, if there was anything that you could say, you know, to them.
We had a couple repairmen come in, plumbing, spray anything you thought they touched, anything. That's my best advice. And if everybody gets sick, stay calm, just hope for the best and just do what you got to do. You can't slack off a little bit, because you slack off, the fever not gonna go away.
No.
It's gonna get worse. You know, so that's it. You just gotta just stay strict to yourself.
Did people deliver stuff?
Yeah, they treated me good. I got a lot of cleaning products, a lot of masks, a lot of gloves, food. Me and Jamal was real good. We were treated really good.
There was a special event. There was a drive-by, you know, kind of party. What was that all about?
So my birthday was on that Wednesday.
Oh my gosh!
I was so shocked because I was sitting there and I just got done with him, and I'm sitting down and all I hear is bah, 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 bah. And I'm like, what the heck is that? So I looked outside and there's Jackie and all them all in the line with their cars hunking, and I came outside.
That's great.
Basket full of goodies and stuff. I really felt love, you know, that I was stuck. That's my first time ever stuck in the house for my birthday. You know, this is going down in history. Like I've never.
You won't forget this one.
Feels like you and Jamal have an amazing relationship.
Yeah, it's like my big brother. That's my man right there. You know, and that's kind of how you got to be with him.
Yeah.
You know, he wants to be that friendship, that, you know, that bond. You know, like brothers type.
Is there anything about the feeling of this illness that you feel like will be good for people to know about? You mentioned that controlling the fever is really important. Is there other things that you think people would want to know about?
Yeah.
And the sunshine.
Drink a lot of water. Medicine, but I feel like the Tylenol really helped a lot with the pain and the fever.
He's well.
Yeah, he's well, you know, so we're all good. And you can't do nothing but fight it, like I said, you know. Listen to the doctors and everything. Listen to you. If anybody in the company get it, I recommend you. Call Ruth, Lynn, use good help, you know. It was, you know, everybody could beat it. That's how I feel. I feel like me and Jamal could beat it, everybody could beat it, you know.
Yeah.
I don't think Jamal would have made it without you.
Thank you, I appreciate it. You getting me all sweaty, I'm getting nervous. I don't know how to take it. I'm just being me, like I tell everybody. I don't know how to take this. My mom was always telling me, she was like, you just gotta find that way that worked for you. And I took that on with life, you know, when anybody's mad, I try to find that little thing that makes you not mad.
Thank you so much, Joe, for taking this time.
Yeah.
Thanks for taking this time.
Thank you guys for the support.
For myself, to be able to talk to you, Joe, it just it calms a lot of my fears about, you know, whatever, because you listen to the news.
Yeah.
And everybody's dying and you know, you're terrified to go out, but you should, in the face of not knowing what was going to happen, you still stepped up to it. And so that's what we're also appreciative of, is that unknown was there and you still stepped up to it because of Jamal. Yeah.
Life is nothing but an unknown. Life is unknown. We don't know about tomorrow, but we still wake up and we go for it, you know. And that's how I treated the sickness. When I felt that pain and when I felt my fever, I was just like, I was scared, but it was like, I can't be scared and shut down because I won't fight it.
That's right.
You gotta stand up and fight it. Thank you, ladies. You have a blessed day.
Thank you. You too.
Oh my gosh. Ruth and Lynn, thanks so much for capturing that story and video for us. That was amazing. I'm seeing everyone in chat say that they're needing some tissues right now at home. So please extend our warmest thanks to Joseph. And I know that the next video we're queuing up is an amazing tribute to people like Joseph and all of the other direct support professionals. So hit it, Lynn.
Nope, I gotta go back to my share screen. Where is it?
So this goes out to all the direct support professionals. All right. So if you weren't using tissues after that video, you probably are now. And what an amazing photo montage you put together, Lynn, for really acknowledging and recognizing direct support professionals. Thank you. Thank you.
My pleasure.
Thank you so much. Whew, okay, our next speaker is Elizabeth Grigsby, somebody that I have known for the past 20 years. Elizabeth and I met in a professional capacity, and I'm honored to say that our relationship has blossomed into a friendship, and a lifelong friendship, I hope. Elizabeth is the rights advocate at Golden Gate Regional Center. And again, someone that I'm really proud to call friend. So Elizabeth's going to talk to us a little bit about what it's been like to receive services, supported living services throughout this pandemic. Welcome, Elizabeth.
Thank you, Mark. And you are a lifetime friend of mine and someone I really look up to.
Thank you.
I just want to talk today a little bit about my supported living and all the workers that mean so much to me. I get support from an agency called Two Works that's in San Francisco. I've been with them since '93. So, and it's very important that we take the time out to thank the workers who come in every day and get me out of bed, help me maintain a good living. Without the support workers, I can't go to work myself. I can't get my own food. I can't dress myself. And I just want to say, if it wasn't for the workers, people with disabilities wouldn't be able to have the life that we do. We need to really stop and think and really accept of how much we're really paying these essential workers. Because like I say all the time when I do public speaking, that none of us are invincible. We can all become disabled at any given time. So I'm asking you, legislators, think about this. When you think about cutting our services, think about becoming disabled and having someone to have to come in and do your everyday physical needs. And then you tell me what's important to your life. Because right now, you're able to walk, you're probably able to drive, getting your fancy cars, and go home. But what if one day that was all taken away from you and the dropping of your hat, and you needed the same care that we do? When you want to live in your own home and have people come in and help you out with your day-to-day needs so you can have dignity and respect like everyone else. So in this time of COVID, nobody knows how long we're gonna be in this. And we really need to shift things and think outside the box and just take the time out and do a little what I call soul searching inside yourself and ask yourself this very important question. If I got sick today or tomorrow, how would I want my care? Would I want to go to a big institution where I'm just going to be a number? Or do I want to stay in my home and have these essential workers help me have a life with dignity and care? So I'm just gonna say one more thing. I thank Mark Melanson. I thank Sarah Burgett for being the kind of person that always had my back, even when times were rough. And things kind of got crazy. They always stood by my side. I always felt very supported, and that's why I'm the rights advocate for Golden Gate Regional Center, because I believe that all people, wherever your disability is, you deserve the right to live and have dignity and respect, just like people without disabilities. And legislators, I challenge you to think outside the box. And the next time the budget comes up, don't let us be the first thing you cut. Because think of this, we all can be disabled. None of us are invincible. So thank you for letting me have this time to speak to you. And remember, I'm a force to be reckoned with. I'm an advocate. Yes, I work for the regional center, but beyond the regional center, I'm advocating for the disability community, my community, my people. So thank you very much.
Oh, Elizabeth, always enjoy hearing you speak. Always such wise words for us. So thank you. It's really appreciated. You keep me in check, and you definitely advocate for your people. So thanks for taking the time to present for us today. Appreciate it. I'm going to move on to our next speaker now, Geneva Zayore from Manos. Geneva is the Vice President of Manos, an agency here also in the Bay Area. Geneva is also the President of the California Respite Association, and she's going to talk to us a little bit about the invaluable in-person respite services that have been happening. And Geneva, I'm sorry if I slaughtered your last name, but I know you'll introduce yourself when you come on screen. So welcome, Geneva. Do we have Geneva here?
We cannot hear you, Geneva, unfortunately. She's not muted for some reason, but her audio is not coming out. One moment. Go ahead and unmute one more time. Still no sound for some weird reason. I don't know what is going on.
I have versions of the video that Geneva was going to share. And maybe while she's working to unmute, I can queue up one of those videos. She has, Geneva was able to get 3 videos from folks who are either parents receiving in-person respite supports or support staff that are providing respite supports. So let me share my screen, and I will play the first video that Geneva has gotten for us.
Hello, my name is Josephine Ponce. With the COVID-19, I have respite. And boys, it helped me a lot because I am a diabetic myself. I do have a learning disability myself. So it gives me other things that I can do that I need to do for myself. You know, the person helps them with homework and, you know, interacts with them because he does have bipolar. He has a lot of needs. So it's very hard on me. So with the services I get, and I thank God for it, that, you know, that it helps them a lot, and it helps me a lot. Like I say, she does games with them. Can't do much outside, so, you know, it's basically like working together, doing stuff and homework and stuff like that. And I don't know what else to say, but I'm thankful for this program that I have, and hopefully we'll always have it, because it is something that, you know, we need. And I thank the company and for their too, and for the people that do work for the company, because they are too risking a lot too with the COVID-19, and they're doing good. Thank you.
So that was one of the videos that they were able to record for our legislative briefing today. And I will now share the next video.
The service been helping me, and be helping especially my son. Right now that the schools are closed and daycares are closed, now I'm able to go to work, you know, without like worry and like, you know, who's going to take care of my son. He's been really helpful for my son. He's able to talk more. He's able to, you know, like interact. He's able to interact more, and he's really doing amazing. You know, I'm so grateful, and I just so helpful with the service.
Okay, and the last video that Geneva was able to forward on to us is from a direct support professional who provides respite services through the agency that Geneva works at, Manos.
Hello, my name is Sonia Wiley-Hill, and I work with Manos in Home Support Services. And I'm here to share a little insight on how COVID has impacted me and the communications with my clients. When it first started, of course, clients didn't have an understanding to what COVID was or what's going on with COVID. So it's kind of hard to get them to understand the sheltering in place. A lot of clients that go out, you know, they're used to an everyday, you know, routine of going out, running errands, taking care of their essential needs, but due to the shelter in place, we were not able to do a lot of the things that we were doing in the past. So it impacted a lot of clients on the understanding of having to stay in home. Also, what I do know is that me coming to their house during COVID was very important because we were not able to do a lot of the things that were on our regular schedule. Just me being there with them made a big difference. Me being there to able to help share and explain with the mothers and, you know, parents what COVID was and why we have to stay sheltered in place and why we can't do certain things. It helps support the mom in a big deal. A lot of the parents in a big way. So I also think that COVID helped bring a lot of families closer together with parents having to stay at home and work. They were able to pay more attention to their kids' needs and really see, you know, the effect that changes can make in their lives.
Okay, stop right there. Some wonderful footage, and I know that Geneva would echo many of the comments that were said before about the critical need for those in-person services for families of small children at home or adult children who live at home. It's just been invaluable for them to have direct support professionals entering their home and providing those critical in-person supports. And, you know, as Judy Mark mentioned a little bit earlier, who knows how many of those families used day programs and respite to be able to go to work, and what's that looking like for them. So that's a critical area that really needs to be looked at, is how many folks were using day services to go to be employed, and now they're getting called back to work. So I hope I did you justice, Geneva, and I'm sorry for that technical difficulty, but I'm gonna let my lovely co-host, Jackie Dillard-Foss, introduce our next speaker.
I'm assuming he must be Pat Sajak, so that means I'm Vanna White. I'd always wanted to be a spokesmodel. So I want to introduce Debbie Davis. Debbie Davis, first and foremost, she's a peer provider in the North Bay Regional Center, but she also is my lead in the Hunger Games, because Debbie and I had a lot of fun getting N95 masks and hand sanitizers in the midst of. So she kind of began that Hunger Games theme where we're all out scavenging everywhere for supplies. It's gotten better, but in March and April, it was probably the most stressful part of our job. Debbie Davis is the owner of Special Care Services, which provides various programs in the Solano County for adults with developmental disabilities. She has a Master's of Science degree in nursing with an emphasis on pediatric trauma and special health care. Prior to working for the developmentally disabled field, she worked as a neonatal and pediatric intensive care unit at several California medical centers. And then she decided to grace us with her presence for folks with developmental disabilities. And she probably didn't know what she was getting herself into, but Debbie Davis has done extraordinary work to ensure the health and safety of the folks that she supports, who are all very significantly medically fragile. And I'm happy to say now, I can introduce my friend, Debbie Davis.
Thank you, Jackie, for the introduction. It's great. This has just been a very awesome meeting today, and I have mad respect for everybody's presentations. This is great. Mine really will be focusing on the medical SLS that we provide, which is a very small program here in Solano County, but very vital to keep people out of hospitals and institutional settings. So I'll be sharing my screen if I can get it done. Yes. Okay.
Got it. Yep.
Got it. Now I just said it's not. Okay. So the reason we do what we do is direct support, all of us. And we really believe in individualized person-centered services and the need to do it in person. And it is so important for especially I mean, the people everyone supports, but for us, it's those with really medical issues that would otherwise not be able to live at home. So lots of things like seizures and tube feedings and tracheostomies and injections and just, you know, all kinds of things that really take more than a generic home care service. So we do have nurses as well as direct support professionals, and our DSPs are mostly trained in healthcare, CNAs, home health aides, medical assistants, things like that, but then we give them more specialized training. So it really provides the least restrictive environment for a lot of people that would otherwise be lost kind of in the hospital system. For the pandemic, Jackie referred to the Hunger Games, and yes, it was, and it was I think a lot of us have PTSD still from that time, because we were literally scrambling around, not only for PPE, but to remember the toilet paper shortages and the paper towels and basic products. And back at the beginning, when I would go into Costco or other stores and say, hey, I'm a provider of services for developmentally disabled individuals. I have all these people to support. Can you give us bulk supplies? Oh, no, we don't do that. So it really was a challenge. And in some ways it still is, although, as Jackie said, it has gotten a lot better. But the early months were just very stressful. And then just knowing that this is going to continue, it's not going away anytime soon. So we really all have to be aware and vigilant of all of the supplies we need, as well as reminding our staff and our customers and everybody we work with to continue the protocols that have been set up for disinfecting and cleaning and all of that. And then, of course, employee management. Our staff freaked out. We freaked out. I mean, it was a very scary time for everyone, just going through that beginning. We did have a lot of chaos at the beginning, like I just said. Now there's more support from both the state and the regional centers as far as availability of PPE and supplies, some reimbursement for some of the extra supplies that we're purchasing, but we still need efficient testing. I'm one of those agencies, and we're tiny. I only serve eight people, but most of them have 2 staff 24/7, plus the nurses going in and out of the home. So a very labor-intensive population. We still need testing. We can't wait 2 weeks for results. So we are one of those agencies that ended up spending a lot of money to get a private testing service to come on site twice a month or more. If we have an outbreak, they'll come anytime, and pay for that out of pocket. So that's something we still need in the state in general, and specifically for vulnerable populations, for the staff that are working with them that then leave the home and go out to their own community and homes and families. Financial considerations, reimbursement rates for direct in-person services are already too low to cover all of the expenses that we have. Most of us end up, looking for other sources of revenue to help meet that gap. And most of us do not have enough reserve to just cover deficits for any length of time. So rate cuts for services such as SLS, ILS, respite, in-person type services would cause many providers to either just decrease services or stop altogether, or pivot to a more sustainable model that they can actually bring in some more revenue. For example, my agency would probably be stopping medical SLS if the state cut reimbursement rates in 2020. We would do other things, but that's just a very, there's a very small margin as it is. So that's what would happen with our service. And then overall, long term, the state would end up paying more money because more people would have to be institutionalized, hospitalized in facilities, rather than living in their own home community. So I think taking a longer look at the situation rather than a short-term look at the immediate budget, super important for the people we support. Here's some of my happy moments in the last couple months with some of our people. Our DSPs have just stepped up tremendously, and I can't thank them enough. And our nurses and everyone is just really, for the most part, everybody's all in. This is why I started my agency. My nephew D'Angelo had, Cornelia de Lange syndrome, which is a very rare and serious genetic condition that causes lots of disabilities. But he was the light of our life. He died when he was 25, 2 years ago, but we supported him, his whole life before that, from medical foster care, then back to work. So that's why I do it. That's why I continue to do it. And I thank you all for doing what you do. And I really hope that the legislators can get this message that, we are essential and we need to be supported in supporting others. Thank you. Yay.
Debbie, thanks so much for your presentation. Actually, you and our next speaker are some of the most active people on our CCLN listserv, email listserv, which is really how our membership communicates. And you guys put out such thought-provoking emails and questions, and it's a place where we all share resources. So I just want to appreciate how active you are and how you've helped other agencies and other members through this COVID-19 and just even before that, what it was like to be a provider. So thank you so much for presenting for us today.
Thank you, Mark. Happy to help anyone, just contact me.
Absolutely, thank you. So with that, we'll move on to our next speaker, which is Jolie Cannet. She is from Little Red Wagon, also here in the Bay Area, an SLS provider, and I will turn it over to Jolie right now.
Hi, Mark. Thank you. Can you hear me okay?
Yes, we can.
Okay, great. My name is Jolie. The name of my agency is Little Red Wagon. We are in Marin County. First of all, I want to thank everybody for attending and for all everybody has done to fight for the care of the people we support. And as a side note, as an acknowledgement of the remarkable CCLN crew and Mark Melanson, who has gathered us together today, and for years, I personally secretly refer to this movement as the Bowtie Brigade. That's just me. The size of my agency is relatively small. We have 24 incredible employees, 21 of whom are direct service providers to adults with disabilities so that they can live in dignity and safety in their own homes. And forgive me, I'm reading from a script, so I don't try not to take more than my 5 minutes. Our group is not in the category of fragile care. Thank you, Debbie, for all you do. The challenges are unimaginable. But our group is feisty, healthy, intelligent, thoughtful, energetic, demanding, fabulous. Before Monday, March 16th, 2020, the people we support were attending creative and adventurous day programs 6 hours a day in the community. The program sharing up to 130 hours a month of support for each individual. On Monday, March 16th, the programs closed and we were thrust into 24/7 in-person residential support without notice, without a break and without a guidebook. And we have been carrying every support minute of every day since then. We were able to move one person to a new apartment during this time. We were able to start a new individual in supported living services during this time. We have scheduled and delivered 4,000 care hours a month, day in and day out. In March, as we know, there was no personal protective equipment available. There was no testing. There was little information and lots of fear. I sent away for any PPE I could find anywhere in the world, ironically, China. I appealed to anyone who would help with masks, sanitizer, bleach, eye protection. One of our DSP staff offered her few masks from China that a friend had sent her 3 months prior, telling her, "You are going to need these." This DSP shared 15 of these precious masks with us so the staff and the people we support could have them. Another of our DSP's family worked on a worm farm where they were willing to share their extra masks, both DSPs refusing any remuneration. I asked a dear friend if she would make some masks, and she came through with 25 of them, all colorful cloth. I sent away for gouged priced gallons of alcohol and aloe vera and made my own sanitizer for all the homes and staff. I went from gas station mini mart to gas station mini mart and bought 2-ounce sanitizer bottles for $5 a piece for each staff and the people they were supporting. We made our own disinfectant from a 1-gallon bleach bottle I was able to find behind the counter at Walmart asking the cashier at Walmart, explaining our situation. I was able to score a gallon of bleach. And then we went to the Dollar Tree and bought spray bottles and just made our own disinfectant. I sent away for hard plastic construction glasses for eye protection for my staff. I stood in line at Safeway outside at 6 a.m. to try and get Safeways and toilet paper for the people and staff we support. I sprayed the cart myself with my own sanitizer at some level. And I'm not alone. I'm not the only one doing this. My staff are working 24/7 as well. At some level, while the supermarket shelves are now amply stocked with sanitizer and the mysterious toilet paper shortage seems to have been solved, this quality of attention and risk remains. The regional center stepped up with funding those hours, but not all of the exponential increase in administrative hours due to strategizing, Zoom meetings, directives, reports, searching for PPE, trainings, visits, emails, and writing funding submission requirements have been covered. We are grateful to be working and to be helping during this odd and unexpected time, but we have had neither relief nor mitigation of any risk. Instead, we do the frontline care and protect those who are sheltering in place, not just the individuals we support. This includes the families, the administrators who otherwise would have to meet in person themselves for annual meetings and quarterly visits. This includes the day programs who have summarily closed with no clear plans of assisting on the residential level at this point, and whose staff delivers Zoom programs instead, while we are still supporting the individuals in their homes at the same time, even while the Zoom programs are being delivered. Probably due to the unusual circumstances we all find ourselves in the rush of change as an SLS agency, one of the most vital points of support in the chain of care offered by the DDS and regional centers, we have not necessarily had a voice in these changes and expectations as they're taking place. Instead, we just stepped up and continue to do so. The expectation being that we will continue without a safety net or funding guarantee. We all assume this would be short term, but we are now settling into a full adjustment to the new situation. And as such, we need to take a closer look at the long term and our place in it. I think everyone here agrees with that. After working nonstop, struggling every day to keep things on an even and safe keel, due to the complexities of the system, there have been some frustrating delays in the billing and reimbursement due to confusions and changes. These are no doubt sorting out, as we are all under the umbrella of constant change. Case managers and administrators are also stepping up and doing their best, but the pressure has been enormous. I guess what I would like to say is that we're stretched to the breaking point. I'm not complaining. My intention is to make things better. We are not just essential, we are vital to the survival of the people we support. And by we, of course, I'm including my direct service providers. I'm just an administrator. We are not remote. We are not a Zoom program. We are hands-on every day. During this new and frightening time, when there was a threat that our funds would be cut, I saw the care of thousands of vulnerable people, Californians, and their families and communities being potentially compromised to disastrous results. Realistically, I can see upcoming potential cuts in the state and federal budget due to the soaring costs created by COVID-19. Right now, we are in a triage, as Dr. Myers mentioned it medically. I'm mentioning it administratively and with our direct service providers in terms of resources. All businesses and budget cuts choose to approach triage and emergencies differently, but all have the same purpose. In a situation with limited resources and overwhelming need, we attend to the most severe need right now and set the lesser emergency aside for later attention and remaining resources. That's one definition, one part of triage. Health, protection, and safety first. In a burning house, few of us would grab our laptops and iPads and leave the family behind. Supported living services are the front line of direct care for people whose health and safety would be seriously compromised to the point of loss of life or compromised mental well-being without our care. We are the lifeblood. Right now, in the panoply of need, as a supported living services agency, we are screaming for two resources: continued funding and more funded direct residential support for those who are able to be safely in the community by those who are now providing Zoom support programs instead. Even if they're not able to be safely in the community, they would still like to have human, in-person contact. Continued funding, relief during the weekday hours, more boots on the ground to take distanced walks with an awesome, visually impaired, intellectually challenged woman who misses her cat visits to kitty corner, to plan a hike outdoors for a young, mentally compromised young woman who's used to socializing and engaging with her community, to help with shopping and chores, to visit on a balcony or an outdoor space, to provide human, three-dimensional, visual, safe contact to people who do not connect well to a screen. Can you imagine if you are experiencing Zoom fatigue, not this meeting, of course, but what it must be like for people who have a scarcity of social interaction anyway, to have a picnic, to help at a doctor's appointment, to laugh in person, to show up, not volunteers, funded residential staff providing person-centered, individually designed day programs to help out, not just exhausted SLS administrators and staff, but the people we all support to enjoy the least restrictive environment possible. And the elephant in the room, to share the risk, to take turns. That's what defines courage in this new world we find ourselves in. I'm almost done. If you have a family member or client or friend with a disability, and I know many of you do here, and you have the luxury of sheltering in place or working from home, thank a supported living services direct service provider for protecting not just the person you love, but you, your office, your family, and your neighborhood as well. If you are ever in a position to help in any way with support, legislature, or funding, you are certainly welcome here and certainly needed. And you define the new courage, along with the relentless, capable, remarkable, and optimistic direct service providers in my agency and in every single supported living services agency in California. Thank you.
Jolie, thanks so much. I appreciate all of your comments. They all, you know, just resonate so deeply with everyone on the call. So appreciate you taking the opportunity to speak to us today. Folks, I know we're at 2:04, but we are just about to get into employment. And we've got 3 more speakers, and hopefully we can hang in there for maybe another 10 minutes. So I'm gonna quickly turn it over to Maddie and Carl, job coach, and Jackie, do you want to say anything more about our next
I thought
speaker?
that Lori and Scott Shepherd.
Oh, sorry, Laurie first. Laurie first, that's right.
That's my entire role.
Again. Laurie, Avenues SLS. They have also been doing some amazing speaking on some of the DVU webinars, such an excellent resource on our CCLN listserv. Are going to tell us, talk a little bit, as I said, we're going into some employment next. And as California is an employment first state, this is really important stuff. So Laurie, welcome.
Hi, thanks. I will not make all of the extra points I was going to make here. We are engaged in empowering people to be part of their meaningful routines, to get back into to what they were doing, and really we've been doing this since April. You know, we're also are very focused on empowering agencies to engage in their mission statement and to follow their program design and do what they're doing. You'll see a couple pictures here on the left. One of our ladies in the bank cashing her paycheck, right? An important, essential routine. And on the right, David is employee at Ralph's, and I'll speak to him on a few more slides down here. A couple more people here working their essential jobs. Jareth over here on the left works at Target. He also worked at a movie theater, which of course is currently shut down, but his hours at Target increased. He did get combat pay, and he's actually making more money now than he was this time last year, which is excellent for him. Javin in the middle works at Dollar Tree. His hours were also increased. All 3 of these people do receive job coaching services, and their job coaches stayed on the job with them. All their job coaches do work for us. And Melanie on the right, many of you know her from speaking at TASH conferences and CalTASH conferences. She works in our office. We did have her off work for a few weeks while we worked out how we were going to be safe, but she came right back into work because the filing does need to get done. So many people are understandably frustrated by the changes and the restrictions in their essential routines, their employment and volunteering. That goes across the board, not just people with disabilities, people across the state, people across the country, people across the world. But we have seen that people who have been able to keep their essential jobs and routines are the ones that are coping best since March. Again and again, our staff are doing great. They're working. Our guys that kept their jobs, they're working. This picture here on the left, he actually lost his job, and he had a tough time. We've been finding him temporary jobs. Whenever we get calls for people who need houses cleaned or anything like that, we're sending him over. He thrives in working. And the supported employment agency that supports him has not been able to, or in my opinion, hasn't tried to get him more work. They're just waiting for his jobs to open up, and that's just not fair. Obviously, and it goes without saying, I think we did coaching at the very beginning around being safe and wearing your masks and social distancing and all that stuff. We're way past that. So David is a story we really wanted to share with you today. He's worked at Ralph's for over 14 years as a courtesy clerk. Changes have always been difficult for him. He uses the services of a supported employment agency, but in mid-March, they notified him that they were going to stop providing all in-person direct services and job coaches starting immediately. Of course, that was a time when he more than ever needed those supports because there were a lot of changes going on at work with wearing masks and social distancing and not being able to be in the break rooms and things like that. So he was predictably panicking and didn't know what to do. And so we had to step in. As his supported living agency, we had to step in and help him keep his job. Because instead of needing less support, he required more. And instead of having a job coach come in for an hour a day or a couple hours a week, he needed a job coach on site with him during his whole shift. He also needed to learn, as did we all back then, how to wear his masks, how to wear his gloves, how to social distance, and it required constant ongoing coaching for those first few weeks. We had to be there, and his supported employment agency was not. We also found out that we needed to be the ones taking him to work. He couldn't take the bus to work because his previous routines included getting to work an hour early and hanging out at McDonald's, hanging out at Starbucks, hanging out in the break room, all things that were unavailable to him. And so if he got to work early, which he would do if we weren't there, he would be ready to go home before he even clocked in because of the stress around the changes in his routines. So we began showing up to his house and picking him up before he could jump on the bus and get to work early. So again, our hours with him increased dramatically in March. Now, this next slide I want to show you is something that I'm advocating for everybody, really. This lady, Sharon, went to a traditional site-based day program and was very upset in March when she found out she wasn't going to be going for the foreseeable future. And she had us driving by that agency's storefront every day and asking when they were going to be open and why can't they be open, and you know, I hate this COVID and all the things that we all heard. But you know, after a few weeks, she was starting to get into the routine of what we were doing with her. She still wanted to go back, but she was pretty happy with what we were doing. Within a couple months, she decided she wasn't going back. And at that point, we were aware, of course, that her day program was getting paid to do nothing. And she was at the point where she decided she didn't even want to go back even when they did open. So she wrote a note to her regional center counselor. I've redacted some of it, but it says, "Dear counselor, I want to know the best, I want you to know that the best day for my quarterly." So her counselor initiated the communication by asking about a quarterly. So she's saying that the best day for my quarterly would be on Thursday the blank. I'd like to do it on video from 10 to 11 o'clock. I'm going to terminate this day program when I return from my mini vacation. And then she gave a date on a Sunday, so I can transfer to Avenue's day program on this date, which is a Monday. Now, interesting things about that, I think you can all read into, and I know we don't have a lot of time, but you know, she is initiating, terminating a program that isn't working for her. Don't we advocate for people to do that in the best of times? She went on a mini vacation. Clearly, she's not being held back by this. The picture shows you that she's wearing a mask and she's safe, but she's getting out. So I think the point that we wanted to make from this story is that everyone has rights to services that meet their needs. And part of the jobs of regional center and providers is to help people understand their rights and understand their options and act in their own best interest. So if we still have people out there that are not receiving the services that supports that they need during the daytime, let's teach them their rights. Let's teach them their options. Let's get them to write a letter like Sharon did and move on. So that's it.
Lori, thank you so much. And what an amazing advocate Sharon is, right? Listening to Debbie and Jolie and Lori, it just reminds you that, you know, when things happen, SLS is always there to pick it up, right? That we're the fallback, and that you guys are the safety net for so many folks. So thank you so much for your presentation. Appreciate it. We're going to go a little deeper into employment services, and we're going to hear from Maddie and Carl, and I think we have Rebecca, who's going to help.
Yes, Maddie and Carl is going to speak. They do need voice interpretation, just to let you know, Brenda.
Oh, and let's thank our interpreters right now, because they're going OT themselves. Thank you, interpreters.
Oh, I'm on my own.
Oh.
So, okay. You're welcome.
Thank you. Are we able to pin a video screen for them, or will we be seeing the interpreter, Jessica?
One moment, please. They keep calling me to the room, so I'm going to go assist them into that room real quick.
Got it. We do have one more speaker after this, and Carol, thanks for hanging on.
There we are.
Oh, great. Okay, wonderful.
I'm Rebecca Laboriel. I'm the Director of Employment Services here at STEP Agency. Maddie and Carl are essential workers, as we all are, DSPs, and we're going to hear from Carl and Maddie as to what is the most important part of their job. So Carl's up first. Carl, what does it mean to be an essential worker?
Yeah, hi. Hello. My name is Carl. Hello. Yeah, happy Friday. And when I clean out the toilets and do the janitorial, so to get paid, you know, if you get sick or something, I let them go, and then I do a deep cleaning after the places have been visited. So I make sure that any of the viruses and everything are cleaned off and the less chance of anybody getting sick. I put boxes away, move things around. So get paid a little bit more with that. And of course, we wear our mask and glove as well while we're doing the work.
What's been the hardest part of COVID-19? Can you hear me?
I can't hear you.
We can barely hear you, Rebecca.
Okay.
Still can't hear you.
We can still barely hear you, Rebecca. Oh no, I think their mic has cut out for some weird reason.
Okay, let's move on to the next speaker, Jessica. Is that okay?
I'm sorry. Yes, we were going to move. Unfortunately, we're having to, it's not working in there for some reason.
Okay, let's move on to the next speaker. I want to welcome Carol Attillo to the program. Carol's the Executive Director of Progressive Employment Concepts. Carol is on the board of CalAPSI, and I have the pleasure of working with Carol on the Path Forward Collaborative. And so excited to have her wrap up today's program and tell us a little bit about employment services. Carol, thank you.
Hi, thanks everybody. Just want to say I truly appreciate all of the work that supported living agencies have been doing. One of the things as a day service employment agency that we really thought about when this pandemic hit was our partners in supported living, who we knew were already stretched staffing wise, and we knew that adding additional hours was going to stretch them even more. So progressive employment concepts and community employment services up here in Northern California, we serve about 127 individuals in employment, in doing discovery and customized employment, in volunteer work, school support, and general community access. I believe we were very blessed and able to be as nimble as we were because we are already 100% community-based. We don't have a site or facility. We have fairly individualized services, and that allowed us to very quickly, within a day, we shut down March 18th. We sent a survey out to our clients, our provider agencies that we partner with, and to families asking what services they would like from us and needed from us in the shelter, with the shelter in place order. And on March 19th, we opened back up and we're providing services. Some of those services were working with our partner SLS agencies or families and going and providing the same supports for the same hours that we would have been supporting people originally, and just changing how we were providing those services, providing them in people's homes, really trying to continue to focus on people's goals, but looking at how we could do those differently in their home. If somebody was working, volunteering, and one of the things that they really loved doing volunteering was making sure things were sanitary and clean, well, we just parlayed that into doing that in their home, right? Which was needed and necessary anyways. Helping people get the PPE that they needed, learning how to wear their mask, learning how to disinfect and clean their house, all of those things we started doing. We also provided support to all of the people who were working and who continued to work in their jobs. So our job coaching never stopped. I apologize, Lori, for the job coaching that stopped for your folks. We did not. We went right into work with people, and yes, we have had the same experience where people have needed additional supports, folks who were fairly independent at work who now needed help adjusting to the new routines and the new rhythms of their job. So we've been doing that. We continue to work with individuals and their families. Some of the things that I really wanted to let providers of day services and employment services know that were critical in helping us continue the work that we were doing. And that's person-centered thinking, person-centered planning, person-centered healthcare plans. Those were some of the first things that we started doing. We had already been doing those things with folks, but really took a deep dive into the person-centered healthcare directives for people, because a lot of our clients were terrified. They were terrified of getting this disease, going into a hospital, and what might happen to them. So we really wanted to allay those fears and help them kind of take some power back in that respect. And then looking at how could we continue to provide services and supports to folks over the long haul of this situation by really looking at what did they want, how did they want their services to look. So we've continued to modify, just, you know, as things open up, we take another step forward with people. As things close back down, we take a couple steps back with people, continuing to provide what support they need and want. We currently have 67 of the 127 people that we support receiving in-person supports only. We have 34 that receive virtual supports only, and that is at their request. They're still fearful. And then we have 16 people who are receiving a combination of in-person and virtual supports. And then we have 10 individuals who are receiving no supports. And some of those are individuals who are locked away in group homes and licensed facilities and not allowed, even though their rights have not officially been taken away from them. They have effectively been taken away from them, and they are not allowed to receive any support. So we currently have 69 people working that we are providing and continue to provide supports to. So I would say that I'm fearful, like all of the SLS providers, that a lot of the alternative services will allow providers to not step up and provide in-person supports. I do understand the need to try to keep the essential workforce of direct service providers working in some capacity, but I believe that we have models that we can replicate of being able to provide good in-person supports, partnering with our SLS agencies, partnering with ILS agencies, partnering with families and individuals to really figure out how to just sort of blend all of the and braid all of the services together to wrap around and help people continue to move forward in their life. So that is, I guess, a couple things. Technical assistance to providers to transform their services, desperately needed. There are people out there that want to do it. They just don't know how. They haven't been doing this like we have for 25 years. They only knew day program where the bus dropped people off. That's all they knew. And they need technical assistance. They're willing and wanting to, but they need to know how to. Increased flexibility for tailored day services is desperately needed. I think that's the key to helping people get the services and supports that they need, and increased access and ease of participant-directed and self-determination services. Thank you.
Oh, Carol, thanks so much. And thanks for hanging in there with us while we ran way over our time. Folks, I want to wrap it up by just thanking our amazing cast of speakers. I want to thank all the support that I got to put this event on from the board of directors of the California Community Living Network, the folks at STEP, our interpreters, thank you, and to everyone else who, to the 111 people that hung in 25 minutes longer than we said that we would have you. And lastly, an enormous thank you to the direct support professionals during Direct Support Professional Recognition Week. So we wish you all the best. We want you all to stay safe and be well. And this will be posted on our website for future viewing. So please do go to that website, ccln.org, and you'll be able to see this entire program all over again. So everyone, thank you. Be safe, be well, and we shall see you soon. Bye, everybody. Thank you.